Um, for example, in introduction, there's communication Q&A with Teepa Snow. This one is a video. Claire's story, that is a care story. It's just a caregiver interview that we found was really impactful, and that has been transcribed on the portal. Uh, in responding to repetition, there's a try it out lesson. Um, Caregivers, I'm sure, are facing this on a very frequent basis. The loved one is telling them a story about their mother reminiscing about 50 years back, and they're telling it over and over again. It can lead to caregiver burden really, really quickly and burnout. So caregivers can experiment with this lesson. It's an interactive scenario-based lesson. They can pick and choose how to respond to that situation, and the system and the lesson will also tell them, okay, this option was amazing. It was a good choice because this way you were able to get your loved one to calm down for a bit and you didn't stress yourself out. And then for the other options, it would also explain to the caregiver why you would be tempted to do this, why you'd be tempted to snap, but it's not really a good idea. Again, videos, all of these lessons, as you can see, are really short. They're 2 minutes to 5 minutes long. They will be delivering the value in that amount of time. Under difficult situations, it helps caregivers identify exactly what difficult situation they want to read about and give them tips on dealing with it. Unwanted sexual comments, responding to swearing and cursing. I'm just going to click into it and show you in detail. On each lesson, you'll see that there's an audio associated with it as well. Also, another update since we last talked, the audios are available in English and Spanish both. So if there's a caregiver who primarily speaks Spanish, they have the option to have it read out to them in Spanish. Within the lesson, there's cues to try this and then try multiple things and then reflect on which of these options help them the most. It has very distinct and succinct conversation starters as well and activities for them to keep in mind. All of these lessons will also be available to download as a PDF. Very common situation, caregivers probably do not have internet at their own home. There's a challenge with broadband. They can still go to a library or an internet cafe or a senior center or a friend's place, whatever works, and they can download the PDF. PDFs are also available in English and Spanish, so they can choose what language works best for them and they can download it. The PDF has been designed to look pretty similar to the online platform so that there's not much of a gap between what's digital and what's on print. Okay. It's gonna load any minute, I promise. We can come back to it. There's one part of this toolkit that I'm really fond of, and that is the TrueAlta companion cards. This is also available as a downloadable PDF. When caregivers are in a public place and the loved one starts acting out, there's people observing who have no idea what's going on, and it can get really embarrassing for the caregiver very quickly. But pretty confident that everyone else would be very empathetic and would be very understanding if they knew what was going on. So there are these companion cards that are available for download on the portal itself, which has a very short message. My companion has dementia and it changes how they think and act. I appreciate your patience, support, and understanding. This is a very dignified and a discreet way of letting someone know about their care situation. Uh, I anticipate this being very helpful for caregivers. I'm gonna pause and wait for any questions you guys have or any comments. Oh, finally, this did load. So as you can see, the PDF is the same text as the online portal, but it's also a similar format.
It did seem we had one question about the Spanish feature, Kunal. Is this available just in the toolkit, or is this throughout the website?
As of now, this is available on the toolkits, and all of the toolkits that are going to be added subsequently will have Spanish with those as well. With the content that's already on the portal, we're still working on getting that translated. The reason it's taking time is we're having translators and experts doing the translations because it also needs to be culturally relevant for in the Spanish language. So that's why it's taking a little longer than usual. Any other comments?
Comment, not a question. One that I read is from Rachel, who shares that they also print some of the material at the EDRC so that they can mail or email out to caregivers.
That's a great idea. And that's also a situation that's not too uncommon with a lot of caregivers facing the technology barrier. Staff members and coordinators like you pitch in and download these PDFs and mail it or mail it or send it to caregivers, however works best. And that does resonate with caregivers a lot. I mean, technology is a barrier, learning is not. It's just identifying what exactly is their pain point. Thank you for that comment, Rachel. One more slide from my end, and that is the staff corner. We have a new feature available, which is the activity feed. Before I get into it, I know there have been a couple of questions around reassigning caregivers. Um, there was a caregiver coordinator who is no longer with the organization, and the caregivers under that coordinator need to be transferred to someone else. We're working on a very efficient way for this transfer to happen, and also, in turn, a short and easy way to do it. So Bryn and I are on this, and we'll keep you posted. If for now, all of the changes that you need to request, can you send them out to Bryn and I, and we'll be tag teaming this as of now. High five, Bryn.
Virtual high five.
Virtual high five. Virtual. And then the activity feed. Okay, I'm hearing my own echo and I can hear my own voice, which is really, really kind of scary. First of all, thank you guys for listening to me. My voice is not really easy to listen to. I just realized that. Activity feed. If you want to monitor and analyze what your caregivers are doing, this feature is going to be very helpful for you. A lot of times, there's not a lot of instant gratification with being a caregiver coordinator. You give them these resources, especially education resources, and you don't know if they're using them, if they're reading them, what they're doing with it, and if it is benefiting them. With the activity feed, you can monitor exactly what caregivers are doing on the portal and use that information as well. It could be actionable because that would make for deeper caregiver connections. If you see that there's a caregiver who is searching for um, help with sexual comments, for example, that is not something caregivers want to discuss very openly. But that is a hint for you. They're searching for it on the portal and you can see it, and you can probably recommend some content to them. You can reach out to them and initiate a conversation. You will also be able to filter by activity type and users. let me show you one of our demo portals. I don't want to get into the Wisconsin portal, privacy concerns, etc. So I just want to show you the demo one. On this demo portal, this is what the activity feed looks like. When you log in, the first thing that you will see is your dashboard, and on the dashboard, the activity feed. You'll see that, let's say Asia is one of my caregivers. She read this lesson. She attempted this quiz. She read another lesson. This is what she searched for, self-care. This is how I know that Asia could really benefit from some lessons on caregiver wellness. And I would go ahead and recommend those lessons to her. A couple other ways to slice the activity feed is you can see what comments people are making on the portal. You can see when your caregivers are logging in. It's going to be very interesting to see that there's a caregiver who's logged in 5 times in one day, then they don't log in for 8 months, and then 8 months later, there's a new behavioral symptom that comes up, and they log in 5 times again on that day. You can see what modules people are reading, what your caregivers are reading. This is, again, going to be clue for you as to what your caregivers are interested in, what their care situation is, and how you can help them even more. Quizzes. Not everyone is interested in a quiz. Not everyone wants to take a test, but this is going to help you identify which caregivers are motivated by the gamification.
Our chore workers.
Sorry, was that a question?
What?
Was that a question?
What? No, I mean, can we like just make copies or send to people or no?
I think somebody's not on mute.
Okay, I was just a little confused there, but no problem. That has happened to me in a lot of situations. With registrations, this is going to help you. Example, you're doing a marketing push, you're sending out postcards to your caregivers in the community, and you want to see how that marketing has performed. You can just filter by registrations, and you can see when people are registering. So you can relate that the marketing effort was done on May 24th, between May 25th and June 2nd. These many people have registered. So yes, this marketing effort was worth it and it worked. And then searches, like I said, this is kind of the virtual way of understanding the words that are not said but are searched for. So caregivers are not going to tell you certain things about their care situation, but you can see what they're searching for. Also, you'll be able to filter by user. I can go in right into Asia's profile, and I can see all of her activity at at once. The main activity feed is going to show the activity of all of your caregivers. Within individual caregiver names, there's an activity tab, and this is where you see the activity of only that caregiver. Based on this information, let's say the caregiver search for self-care, you can go into badges and recommend content to them as well. They look for self-care. I'm going to recommend effective self-care to them. Maybe they also need to read about caregiver anger and frustration and reframing negative thoughts. So this way, I can send these content recommendations to the caregiver. They'll get an email that I've sent them the recommendations, and they can that will be just very much relevant content for them. Okay, I'm gonna stop chatting. I'm again gonna stop for questions and comments and feedback.
Just real quickly, this is Lisa from Sheboygan County, and I periodically go in and look at, I guess, my dashboard that you just showed us. I had a caregiver that I did a care consultation yesterday actually log in like 30 minutes ago. So I was able to see that. So that's exciting. The other thing is that the pending ones that I have, I've noticed that if I go into the pending invites where I had, put them in, but they hadn't logged in yet, if I do that a week or two after a care consultation, when they, yeah, right there, thanks. When they've had a little bit of time to let things sort of ease into it, it seems to work pretty well, because usually with a care consultation, things might be overwhelming with all the resources. So you just give them a little time, and then you can click and you can resend. See where that resending is? So a lot of times I'll resend, like 10 at a time if there's some that haven't logged in or registered. But right now I have close to 50 registered.
Snap, snap, snap. That is amazing, Lisa. Thank you for the best practices highlight. This is really a space for you to share your best practices. So if anyone has these wonderful tips, please go ahead and share them.
It's Margaret. I also send an email when I notice that people haven't registered, but they've been invited. And I send them an email letting them know that I'm going to resend the invite, and that if they didn't receive it, to check their spam folder, because a lot of people have told me that it goes to their spam. And that way, if they at least know that to check it, they can. And I did that one Friday, and by Monday I had 7 more. So the more
Wonderful.
registrations.
Here's also a heads up for you guys. If you don't want to get into the invitations and you kind of want to take a step back, you can send them a common link, wisconsincaregiver.trualter.com. They will be able to go in and click on sign up, select the county, select the, answer these questions and register independently as well. And once they register, you will get notified as the coordinator that, oh, you've got a new person on your dashboard. So it's there's no barriers for the caregiver, there's no barriers for you guys. Everyone, and both of you are in the loop. So this is something that you guys might want to try out as well. But by all means, you guys have your processes, which are working phenomenally well. So a big thumbs up. A win for the Wisconsin team is, as of this morning, we are one caregiver short of 700 caregivers on the portal. So that's a huge uplifting moment for all of us. And thank you, guys.
Thank you, Kunal. That is uplifting. It is uplifting, and I share that because TruAlta is something that can benefit caregivers, whether or not they're formally a part of NFCSP or AFCSP. Specifically, I shared too with the Great Lakes Tribal, let's see, what's that stand for? Great Lakes Intertribal Council. There we go. And they're able to operate the AFCSP, which of course has the financial income limits of $48,000 or less. Well, that means some people aren't going to qualify, but at least if you can give TruAlta or other information as tangible supports and walking away items, you're able as a professional to give something that's much needed to that caregiver and to that family at the moment. And typically there's more that aging units and tribal aging units can offer, but in that forum, that was something I also really highlighted with the feature of TruAlta. You probably have noticed that about 25 minutes into our meeting, I was able to figure out how to record, and that's because I'm in separate team groups or meetings. So when I'm logged in as a different team member participant, there were certain features that were restricted. So just as a quick update for folks who might be listening to the recording, we've heard Janet Zander's updates. We will include those materials as part of the archived information. We heard updates from Lynn and DHS with regard to the employer engagement survey, which will be added to our wisconsincaregiver.org site. I provided some training updates for GWAR, which I will include in the notes. We were able to capture the recording of Kunal. Thank you so very much. And certainly not at all least, but last, we do have Jessica and Rachel with United Way 211. I will be quiet so that the last 15 minutes can be yours to share information about your caregiver program resources.
Great. Thanks, Bryn. Thanks for having us today. I'm Jessica Newman. I work with 211 Wisconsin, and I'm going to go ahead and share my screen now. Can everyone see that okay? With our presentation. I also have Rachel Brightman with me, who is the caregiver who leads our caregiver program. So I'm just going to give you a quick overview of 211 Wisconsin to make sure everyone has that foundation of who we are, what we do, and how we can assist you in the work that you have. And then Rachel will hop in with more information about the caregiver support that we're able to offer. So first of all, 211 is a dialing code that anybody can call 24 hours a day, 7 days a week with really any question. It could be, I'm having trouble affording my housing. I can't afford my utilities. I'm having trouble getting food. I'm worried about my mom who lives alone. It could be any of those things that they could give us a call for. And we're here to help them find the answers and make referrals to your organizations and other organizations throughout the community that can assist the individual. Generally, we are not the service providers, but in what Rachel will talk about later, that's our first step into a little bit of a service provider role. 211 is a national three-digit dialing code with purposes to connect people to their local community services, connect people in times of disaster, as well as connect people who are looking to help others. So that means that not only can people who are looking for services give us a call, but we're there to help stand up a phone line in moments of disaster. We're still managing COVID calls and have been for over 2 years now on behalf of the state. And then also, if people are looking to volunteer in times of during COVID or during a tornado or anything like that, we're there to assist. 211 does cover 96% of the United States, so it is a national dialing code, just like you can dial 811 or 411 anywhere in the country. You can dial 211. We do have 100% coverage in the state of Wisconsin, so every single county is covered, and they can call at any time. We do have 8 local centers that are across the state, as you can see on these maps here. If you are in your region and you're not connected with your local 211 office, please feel free to send Rachel or myself a chat or other information, and we can make sure that we get you connected to your local office so you can get your information on our resource database. When people call 211, they call with a question saying, I need help with whatever is their need at that moment. The phone is answered by one of our 30+ team members that are on the phone. It's actually closer to 75 agents, but generally on a daily basis, it's about 30 that are on the phone that are ready to answer their call and their questions to get them connected. What our agents are able to do is not only provide supportive listening and ensure that they're that person feels heard in the situation that they're in, but we also connect them with community resources. We do this using the AIR standards, which is the Association of Information and Referral Services. So we're not just picking how willy-nilly how we do things. It truly is to a standard of excellence. We also assess what the presenting need or secondary needs are. So if somebody calls and says, I need food, we ask about not only do we get them connected with food, but we want to know what caused that need for food so that we can put in other referrals that might be happening for them. So we want to make sure that we're addressing a larger picture as the caller wants. Really, everything is caller driven. We do some brief interventions as possible. If somebody's feeling stressed, how can we help them to calm their body and their feelings in that situation so that they're ready to take that next step? We make sure that they are ready. We give them assurance of what that next step is and they understand what they need. It's not just phone numbers and hours. We're also helping them prepare with what types of documents do they need to bring with them to those appointments? What can they expect from that? What type of payments do they need to have ready if it's a service that does cost something? Does it take Medicare or Medicaid as a form of payment? So it really is making sure that they have all of that information so that if they're going to take time off to make that appointment and they're ready to go, they show up with everything that they need instead of showing up and not having one certain document and not being able to proceed with that time. So we really make sure that they have all those things. We also do a follow-up with the caller to make sure that they're connected. Now, there's another part of our work that you guys don't see or the callers don't often see is you can see there's our horizontal work that we do with community agencies. But the other piece is that we manage through our 8 centers. We get all of the community agency information and put it into our database that our team members are using. So behind the scenes, there's another huge team of staff, our resource managers, that are working to make sure that we have resource curation. And we develop partnerships. We identify agency, site, and service identification within our service listings. We do have specific data coding that we use, and we verify and do regular updates to our database to make sure that everything is as up to date as possible. So it really is, there's a little bit of a vertical flow here too, as well, that helps our agents and our callers. In the last year, you can see in 2021, we had over 2 million minutes of service to clients. We had over 433,000 contacts with more than 455,000 referrals. That means that some people are getting more than one referral as they're giving us a call based on their needs and what best meets their needs. So if somebody calls and needs a referral to right now, one of our call drivers is a lot of COVID information, vaccines or testing sites. We give them multiple testing sites in case they get to one and something has changed. If you're looking for utilities, we're able to help them understand how utility support can stack and support them. And there's more than 20,000 agency locations across the state that we help manage for resources. Here you can see some of the top needs in our calls last year. Housing, healthcare, and COVID, mental health round out our top 3. What's really been interesting for us in the last 2 years is how food and meals has dropped significantly. Here's just another view of that, but food and meals used to be our #1 call driver prior to the pandemic. You can see even in 2020, it was one of the larger call drivers, around #4, but it again has dropped in 2021. We anticipate that with the end of the public health emergency and people needing to start renewing, I should say it's not ending, don't panic, it's going through October, but as people need to start renewing their supports through food share, we anticipate that the food and meals need to rise again. So we also watch data and trends. That's kind of a third leg of what we do in our communities. So that's a really quick overview of what 211 does. I do want to share that if you do have your service listed on 211, please make sure it's up to date. If things change, reach out to your community resource centers. And if you are not listed on 211, connect with us. We want to make sure that your services are listed so that we can refer callers to you in those moments of need. And I'm going to go ahead and let Rachel take it over from here.
Great, thanks, Jessica. So yeah, again, my name's Rachel. I am the information and referral specialist with 211 and United Way. And then with our caregiver program, I am the outreach specialist. So when caregivers get connected, they're going to speak directly to me. So just a little intro about the program. So ARP and 211 United Way have partnered to support caregivers in Wisconsin. So both United Way Worldwide and ARP are strong advocate organizations for populations in need, and that's including older adults and caregivers. So as we aim to support communities across the country, caregivers are just one of many populations where investment in coordinated research, messaging, advocacy, and programming is making a big difference. So as Jessica mentioned, 211 is a free, easy to remember number that is already hyper localized to meet information needs of communities across the country. Jessica, you can go to the next slide. Jessica, oh, am I able to? Okay. Okay, so why caregivers? Very often, caregivers do not see themselves in this role, but rather just helping a family member or a friend, which means that initial 211 calls are often not related directly to caregiving. So someone might call 211 saying, I need transportation for my loved one, or I need transportation to get my spouse to and from an adult day program. So Jessica and I actually created a training for all 211 agents across Wisconsin to take that will give a very detailed overview of what the program covers, as well as some identifying key factors as to when someone's calling in to, send them off to our program as well. So again, by resourcing trained 211 navigators to identify caregivers and meet their initial needs, take steps to dive deeper, and then provide proactive support, this program will push past some of those most common barriers to accessing resources. You can go to the next slide, please. Okay. Yeah, and so just a little bit more in detail about this program. So we offer one-on-one phone calls. This is up to 10 weeks. So that's with a dedicated and trained 211 caregiving specialist, which would be me. So I will provide supportive listening, referrals to resources based on request and needs, follow-up calls regarding referrals to discuss and any issues or additional needs. And then these calls are going to be arranged to meet caregivers' schedules. So I've had some caregivers who just really want to talk for about 2 to 3 times in those 10 weeks. And then I have caregivers who would like to have a more regular schedule. I've even spoken to some caregivers a few times a week. So it's really just what they prefer and the support that they ask for. Okay, so the number one area of help required by caregivers is identifying available help where they live. So while databases can be helpful, caregivers still want advice and assistance. So that's where it's really great to have ARP and 211 United Way together. So ARP has expertise on the needs of caregivers and has developed a robust ability to reach them. And then 211 United Way has a deep understanding of local resources. And we also have this trained staff and the infrastructure to deliver. So we are using ARP's resources in addition to the United Way and 211 local resources together to provide a comprehensive support for caregivers in Wisconsin. Yeah, and so this adds to an already rich network of organizations providing caregivers, agencies like GWAR, which ensure quality care of caregivers in Wisconsin. So along with others that provide training, advocacy programs, and services to ensure caregivers and their loved ones are supported, we are eager to learn ways in which this outreach can walk alongside you, your staff, and those you serve. Go to the next slide. Okay, so I wanted to open up, Bren, thank you. Any questions at all or anything that we can maybe support with your already communities or support networks that you offer to caregivers?
Our caregiver coordinators throughout the state go through what's called a caregiver needs assessment, and it can look like a checklist, but it's also very much geared toward a conversation starter, asking questions to really drill down what is the highest need for that caregiver. If a caregiver is expressing that at this time they've just learned a diagnosis of a loved one and they're more focused on education, resources, kind of preparing for the future, legal stuff, would that be an appropriate referral for supportive listening where you can kind of tackle each of those they aren't direct care needs, but kind of information and referral needs?
Yeah, so that's what this program is really designed for. So with a typical call to 211, an agent will, refer to a resource, and there might be one follow-up just to see if they were able to access, but it might end there. Whereas with this program, I can refer to a resource, and then I can call that agency, do those first steps, get them connected together, so that there's a few, I can kind of eliminate some of the steps to give more time to caregivers. So again, for a legal referral, I can certainly walk alongside a caregiver to support them with what exactly is going on with that resource, and then connecting them to folks who I've already spoken to who are aware of their situation. Jessica, thank you for answering that in the chat.
Yeah, absolutely.
Any other questions? I think we just have one more slide after this. Okay, yeah, so just 2 additional caregiver resources that I wanted to quickly share. So through our partnership with ARP, we can request ARP's family caregiving kit to be mailed to your staff or caregivers who you work with. So ARP's family caregiving kit is loaded with valuable information, materials, and resources for those caring for a loved one. So this kit will include a prepare to care guide, which is for new caregivers, financial workbook for family caregivers, information using ride sharing apps, fraud watch guides, and much more. So it's just a physical copy that caregivers can have in their homes, which we're really excited about. And then coming in June, we have developed a guided search for 211 listed resources. So these will be resources specifically categorized for caregivers and their loved ones, and it is intended to provide easy navigation of available resources. And so that image in the bottom right corner is just a screen grab of what the guided search will look like. So each tile, you can click on it, and then it'll drop down to several categories. When you click on a category, it will directly open up into our database that will show listed resources that are specific to that need. So it'll be an easy way for caregivers to navigate our database when this program eventually does conclude. So yeah, that's all I have in there. I think the next slide is just some contact information, unless I'm missing
And
something.
to receive that AARP
Yes.
guide that Rachel just talked about, you'll want to email us. You can either email us the name and address, obviously with permission of your clients if they're interested in that, or you can email us your name and address, and we're able to lift that up to AARP so that they can receive those documents.
Yes, thank you, Jessica. Okay, I think that's all I have.
Thank you. Both Jessica and Rachel, thank you so much. Thank you, Kunal. Thank you, Janet and Lynn, for the updates. We always cram a lot into these 60 minutes, so I appreciate you guys hanging tight and hanging in there. I will certainly in the GWAR newsletter offer any updates with the June release of the caregiver specific resources. So just again, another plug, if you don't receive that GWAR newsletter, it's chock full of information. So I would encourage you to do that. Also, if you don't have our next meeting on your calendar, it is Tuesday, July 26th at 10 a.m. Right now, our plan is to host Jennifer Heston Mullins. She's PhD and a licensed social worker, a research scholar with the University of Miami, and she'll be sharing information on their program, which is called Our Family, Our Way. Trying to navigate the complex family dynamic and network of different types of caregiving responsibilities. I would also like to offer, because I've really gotten to know some of you so very well, and I am in awe of the creativity and the diligence that you guys do in the work with the families that you support. If there are success stories, if there's creative or unique ways that you're spending AFCSP or NFCSP funding for caregivers, and you're interested in sharing in this large group, I would be happy to begin to carve out some time. That could be in January, that could be in September, November. We could do little pieces throughout each of those meetings, or maybe just one large meeting devoted to it. So in the notes, I will include my contact information as well as Deanna's, Rachel's, and Jessica's. So you guys have all of that contact information that you might need to know for any of the topics that we reviewed today. With that, I see we're 4 minutes past the hour, so I will wrap up and thank you all for attending. I appreciate your time today.
Thank you, Bren.
Thank you.
Thank
Bye-bye.
you.